Hi, my name is Stephanie Mitchum, and I'm a respiratory therapist with the Pulmonary Rehab program. Today we're going to talk about what you need to do and how you need to plan to travel if you are a patient with chronic lung disease. The last thing we want our patients to do is to give up on wanting to go on vacations and visiting family and doing the things that you used to be able to do. So there are a couple of tips. Hopefully you can follow along here of things to do. Now, it's all about planning. There's no more spontaneous trips, or very few. But with the planning, you can still enjoy yourself and have a great vacation. Okay, so let's look at what we need to do. So always discuss your travel plans with your doctor. I know this is something that's new. Why do I need to tell my doctor? Well, as you'll see as we go through here, there are a lot of different reasons why your doctor can be very useful for you to travel. Airlines, cruise lines typically require some type of documentation, especially if you're going to be traveling with equipment like oxygen equipment or a CPAP BiPAP machine for sleep apnea. If you don't know what that is, that's okay. Here's a couple of tips. We've got these outlined at the beginning, and then we'll go into more detail on the specific forms of travel, okay? So when you talk to your doctor, you want to tell them how you're going to be traveling, how long you're going to be, and where you're going to be going. And they'll be able to tell you if they feel like, number one, if this is a really good idea, and we'll get into some of the reasons why later. Number one, create a folder or an envelope with important medical information. You should have a list of all of your current medications, including supplements and over-the-counter like allergy medicine or anything like that, aspirin that you take. And if you're on oxygen, it's a really good idea to have your oxygen prescription with you, no matter how you travel. So what is an oxygen prescription? Most of you don't have the piece of paper that says that you are required to use oxygen. The doctor would have directly sent that to your oxygen supply company. But when you travel, some of those airlines or cruise lines or places like that will require you to have a copy of that. So you'll have to talk to your doctor to get that information. So that will be useful to have with you. Number two, include a list of important contact and phone numbers. This is a list. You could put your primary care doctor in there, your pulmonologist or your lung doctor there, an emergency family contact information. If you're visiting family or someone is at your destination, their number would be good to have listed there. You should always include your itinerary for your airline, your train, or your cruise trip. So that would be good to know in case you're ill on the way or at some point in time. And many phones nowadays, even some of the older flip phones, have a section called "In Case of Emergency." ICE is how it might be listed, and that is a phone number and name that you can enter into your phone so that emergency responders can get that information in case you are found unable to communicate and you're by yourself. Okay, so good information to have there would be a name or a phone number to call, and maybe if you're diabetic and if your blood sugar gets too low, you may pass out. Put that information in there that you're diabetic or that you have seizures, whatever important information you can put in there. That would be a good idea. If you're not very tech savvy, just ask your coordinator in pulmonary rehab and we'll try to help you with getting that information on your phone. Okay. Number three, obtain the name, phone number, and location of a doctor and or hospital in the location where you're traveling. Now, the last thing you want to do is have to look that information up if you're having a need for an urgent care or an emergency. So definitely look that up. One personal example is, traveling to the beach. If we were to have an issue Even just driving in the car, it's good to know where those urgent cares are, which exits on the highway have those either emergency rooms or urgent care. So it's good information to have, and including your destination. This is another probably topic that you could ask your doctor about if there's a doctor or hospital in your location, in your destination that they recommend. Be sure to have enough medications for your entire trip. Here's another reason to talk to your doctor before you go. They can, make sure to get any refills available for you before you go. And you want to make sure you have enough for your entire trip, plus a little bit more. If you're traveling and visiting family and you have an opportunity to stay a few extra days, it'd be nice to know that your medication's running out is not the reason that you have to leave early. So always try to have plenty of medications. If you're flying, keep those medications with you on the plane. Do not put those into your luggage underneath the plane or your checked luggage. It depends on the airline, honestly. Most of them do say that you need to have any medication in the original container with the prescription label on the side of the bottle. Take those, and then if you want to use a pill box once you get to your destination, you can still do that. But travel with those in their original containers. Review your health insurance coverage. So if you get to a destination, it's a pretty large city, and there's more than one hospital system available, it'd be good to know which one is more covered by your insurance. How much is an emergency room copay going to be? Those kinds of things. You'd hate to have an unexpected a payment that you just didn't realize that you were going to need to have, but knowing ahead of time what some of those copays will be and where you will get the best insurance coverage is a good idea to check ahead. And always carry your insurance card with you. I think that one's pretty self-explanatory. It's best to have a travel partner if possible. Some people like to be loners and independent, but if you travel with someone, there's less of a worry on when you have to be certain places and where you have to go, and it's just sometimes a lot more fun. Hopefully you're traveling with someone you enjoy spending time with. Make sure they know your health history. Like we mentioned before, if you're diabetic or have seizures, things like that, they need to know that, and they need to know what to look for if you're starting to have issues. Also, if you use a rescue inhaler, they need to know which one of your inhalers is your rescue inhaler if you need that quickly. They also, if you travel with oxygen equipment, they need to know how to change out regulators on tanks. Now, you may want to do that, but what if you are not able to at that point in time? It would be good for them to also know how to do that, and to make sure they feel comfortable with that. Okay. Now we're going to get into some specifics. I'm going to talk now about traveling with oxygen. If you don't use oxygen currently, just bear with me. We are going to get into a couple more things later, but stick with me because you never know when and if you may need to travel with oxygen in the future. You always need to call ahead. I can't stress this enough. And not just with the cruise line or a airline. You really need to contact your oxygen supplier first to find out if what they need to know. So if you've got a local oxygen supplier, they may be able to provide concentrators and portable equipment locally in your state or your area, but they might not can supply you with things in another state or another part of the country. So that would be good to know when you're first deciding on an oxygen supplier. They can coordinate with another company, but again, that's something you need to find out as early as possible. Sometimes they need that oxygen prescription that we mentioned earlier from your doctor, so you'll need to get a note from them. Take care to write down who you speak to about what. Not everybody works every day, and we don't want things to get lost in the shuffle, so make sure you're documenting that kind of thing. You need to know how much oxygen you need, what cannulas you need, that kind of thing. And you'll need to talk to the oxygen supply company. Even if you're just driving to a hotel, it would be nice so that they can deliver that equipment, even if it's just a CPAP you're renting, directly to the hotel instead of you having to carry all of that on your travel. If you fly, you will need to call ahead. As far as traveling with oxygen, airlines do not allow oxygen tanks on board, only portable concentrators. Now, you've probably seen these portable concentrators, if you don't have one, on television, and they're fairly small. They go over the fit over the shoulder, or they are a pull behind kind of piece of equipment. Either way, you need to make sure that it's safe to fly. Most of the concentrators that are currently made are FDA approved, so you don't have to worry about that, but you want to double check, right? You wouldn't want to get all the way to your flight and then find out that you can't travel because of that. You'll also need to, if you don't use a portable concentrator, you can rent one just for the flight, but you'll have to carry plenty of batteries. Okay, so I go to an example of my own family member. My father had to travel, and they were traveling to Alaska to visit friends, and they took a pull-behind oxygen concentrator because he does use oxygen, and they had to carry a bag about 85 pounds of batteries along with them on the flight to have enough batteries for that long flight from North Carolina to Alaska. So that's something else to consider. Definitely. Now, specifically traveling by plane, oxygen or not, you need to take into account that airplanes, when they fly, are pressurized. The cabin that you're in is pressurized, and there's just not as much oxygen on a plane as there is down here on the ground. Okay, that's a lot of reason why people get really tired when they fly and have other issues. So if you are on the borderline of needing oxygen, maybe you just use it at night when you're sleeping, talk to your doctor once again and ask them if it's possible that you will need oxygen when you fly, so that they can get that set up for you. You need to be thinking about that, okay? The last thing you'd want to do is be short of breath an entire flight. That would not feel good. Let's see. And then moving on, flying also increases the risk of infections just because it's so dry on an airplane. You could potentially get an upper airway infection. And then everybody's just kind of crammed in there close together. So you've got a higher risk of cross-contamination from other people. So, as far as the dryness, make sure that you're drinking plenty of water, juice, or things like that. Avoid alcohol and caffeine, so coffee, tea, things like that. Those things can be more drying. If you're seated beside someone that's coughing or sneezing, ask if you can move. And then also consider wearing a mask when you're flying. Okay. If you're prone to getting infections when you fly, this is something that happens every time. Maybe talk to your doctor about having a prescription for antibiotics just in case. So there's always something, but you got to think ahead. Now, when you fly, most airports are fairly large, and sometimes just the walking back and forth between the gate to the car or transportation can be difficult. So always call ahead and talk to them about having a wheelchair or a motorized cart to help you get between the gates if you're picking up a connecting flight, or even just to get you to the luggage area to pick up your luggage. You need to call them ahead of time usually to do that, but having that in advance is going to save you a lot of energy walking and having to get through the airport in a hurry and that kind of thing. All right, moving on to trains. Some people still travel by train, and it can be a fun way to travel. It's nice and relaxing. One benefit to trains versus airplanes is that there are more outlets, electrical outlets available typically. So if you do have a portable concentrator, you would have the ability to be able to plug that up and keep that charged for you. We're honestly not sure about the oxygen tanks on those forms of travel, so you would want to contact the train lines or ahead of time to find out what all is allowed on the train. Okay, it's all about being prepared. The same with cruises. You do want to contact them a couple of weeks before your cruise to let them know that you'll be traveling with oxygen. As far as I'm aware, they do allow tanks on board. The last couple of patients I've talked to used oxygen tanks, and you'll have to have those delivered by your oxygen supply company, usually prior to you even arriving. So you would want to let them know that you have that coming, to be delivered. Even something as simple as letting them know that you use a CPAP. We had one patient who called and let them know, and they actually had an extension cord in their cabin once they got there, because the outlet was so much further from the bed than what their CPAP would be able to reach. So they did that so they would be able to sleep with their CPAP more comfortably. Traveling by car, you would think there would be less to worry about, and there really is, but you need to consider if you're going to be traveling to the mountains, if you live closer to the coast. If you're sensitive to elevation changes, you may find that you do have more shortness of breath, and so your doctor can let you know if that's a bad idea. Usually we're talking about traveling as far as from North Carolina, traveling by plane to somewhere like the Rockies, you may have some elevation change issues. But even by car, some people are more sensitive to that. And if you're not sure, just talk to your doctor about what you can do to watch out for. Also, when you drive, try not to travel during really peak travel times of the day, when there's going to be a lot of traffic. There'll be more chance of air pollution. The trip's going to take longer if there's a lot of traffic. So if you're relying on equipment batteries to last, you may be struggling there. And if you're sensitive to pollen in certain areas, try not to travel when the pollen's is bad. Think about that ahead of time. Are you going to be suffering from allergy symptoms if you travel during certain times of the year? Also, one thing to consider is the electrical system in your car. If you're traveling with an oxygen concentrator, you want to make sure that your electrical system is powered enough to be able to charge that equipment. So it looks like things are charging when you have them all hooked up, but you may find that the battery does still run out. Now, it can keep the battery from running out as quickly, but you want to make sure that you have plenty of battery power with you just in case you run out. Or plan stops along the way at visitor centers or places where you can plug up your concentrator or equipment like that to charge in increments anyway. It's a good idea to get out of a car every hour or so and walk around anyway, just to, keep the blood moving in your legs so you don't get any blood clots. So that would be a good time to charge any equipment if you needed to. Good idea to also make sure that your car is serviced before you drive. The last thing you want is to find out that you had some car maintenance issues and now you're stuck on the side of the road. So always do that before you travel. I think most parents instill that in us as children, but sometimes we've got everything else to think about. We forget about that. So try not to forget about doing car maintenance as well. I know this has been a lot, but hopefully, all in all, what you're taking away from this is that it's still safe to travel. It can still be fun. You just have to plan a little more ahead. Ask somebody to help you just so you don't forget everything. But as soon as you're going to be traveling, I would even say if months ahead of time, go ahead and call. Go ahead and find out what you need to be doing. The last thing you want to do is to be struggling at the last second to make your flight because you don't quite have all of the equipment you need. So enjoy yourself. There's no reason that you can't visit family and travel and go on vacation with a chronic lung disease. And we hope that you still are able to do that. If you have any questions from this education topic, please ask your pulmonary rehab coordinator, and I hope you've enjoyed this education lecture.